Over 400 injured across India in the past 3 days. Children have lost their eyesight and severe burn injuries reported in major hospitals across India. And this is just the toll from firecracker-related accidents. There are no official numbers yet for the number of patients queuing up at clinics and hospitals nationwide complaining of respiratory distress. Now, to get you an idea of the toll that fireworks extract from you, joining me are Magic Bricks Now reporters Shrija and Aishwarya. They've spent the day speaking to doctors and visiting hospital wards in major cities across India. Aishwarya gets us details from Mumbai.
Mumbai's air quality has gone from bad to worse in just days after Diwali. The AQI that has been recorded is between 300 to 400, which means that the category into which the air quality falls is severe, implying that the air that Mumbai citizens are breathing is extremely hazardous for them. Now, we spoke with a couple of doctors who look after respiratory problems, and they told us that they have seen a hike of 30% in the number of patients who have been visiting them with problems related to asthma, with problems related to severe cough, and they have got some patients which are finding it very difficult to breathe. They said that from last year to this year, they have seen an increase of 30% in these patients. Also, they said that now they have got very young kids as old as 3 months going up to 5 years. And the other category which has seen a spike are people above 50 years old. They said both these categories have seen people and small children being finding it extremely difficult to breathe because of the high levels of pollution. On the other side, doctors at JJ Hospital, at Sion Hospital, at KM Hospital have said that this year they have also seen an increased number of children coming with burnt injuries due to bursting of firecrackers. KM Hospital has admitted 4 young kids aged between 10 to 15 with 20%, 30% burnt marks as they were trying to burst crackers, and those crackers blew into their faces. Sion Hospital currently is looking after 2 kids who have come with burnt marks because of firecrackers. So on both these aspects, when we talk about the pollution that we are breathing and about burn injuries, this year the trend is that they've seen an increase in the number of patients for both these problems.
Aishwarya, they're essentially telling us that the number of injuries because of firecrackers have gone up this year, this Diwali. Let's also take a look at where Bengaluru stands. Shrija gets us details.
Burns, eye infections, skin allergies and breathing problems are some of the issues that came as a package with this year's Diwali celebrations. In fact, compared to last year, this time around the incidence of injuries by bursting firecrackers has seen a decline. In fact, pulmonologists from various hospitals tell us that post-Diwali, they have seen patients, especially children, being admitted to hospitals due to respiratory and lung related disorders. Now, however, in Victoria Hospital especially, what they tell us is they have seen about 30% of decrease, especially in respiratory cases when compared to last year, which was in fact more. In the wards of the city's prominent eye hospitals, many, especially children and women, have been admitted to with serious injuries, especially in the city's prestigious eye hospital, that is Narayana Netralaya. There is a marked increase in the number of eye injury cases from last year compared to 45 cases reported last year, and the number of cases that were reported this year stands at 61. In Minto Hospital, about 24 cases were reported this year when compared to cases at least 32 last year. In Modi Eye Hospital, 9 cases were reported this year compared to 8 last year, and Netradama Eye Hospital reported about 50% decline in cases, reporting total of 5 cases this year compared to 10 last year. Now, compared to last year, there is definitely a decline in the number of eye injuries, especially in Bengaluru this Diwali. In Bengaluru, Shrija for Magic Bricks Now.
Now, whether it is Bengaluru or the city of Mumbai, the story is the same everywhere. Aishwarya also caught up with chest and allergy specialist Dr. Sanjeev Mehta from Lilavati Hospital and asked him about the increasing air pollution and how it is affecting the number of patients with respiratory distress.
This we see every year. This is nothing new. Our patients during Diwali feel very uncomfortable. We did see anywhere between a 20 to 30% jump in the number of patients who came. What is really bad is not just that we see more patients, but we see more intensity of the disease. That's really what worries us.
So when you talk about the intensity of the diseases, which are the major problems that patients come to you, especially during Diwali time and maybe a week after Diwali, because the pollution is still in the air during that time?
Sure. So can I answer that in two parts? So what we do see are patients who are normal like you and me, who would come to us with cough and sneezing. Many of them will come with burning in the eyes because of the pollution. Many would come with a little bit of shortness of breath. Those you can manage. What gets us really worried are the patients who are existing patients of asthma or COPD who come to us with severe exacerbations and they need to be in hospital, and that worries us. They are the ones who are difficult to manage.
Is there any way people can stay away from this, or are there any precautions that you can take to avoid getting into this situation? Because we breathe air is everywhere, and once it's polluted, it's very difficult. So what are the kind of precautions that you would suggest to the people?
So I think the best is not be here. So if you have the option, get away from crowded areas, get away from the city. But if you can't, then a few things. One, avoid going near areas where there's direct exposure to smoke. Try to keep your area closed, your homes closed, use air conditioning. Avoid any other stimulant. For example, don't use things like these mosquito repellents, especially in those days. If the person is already a patient, then I advise him to increase the medication a day or so in advance, and so that they can be prevented and hopefully not have an attack. But really, prevention is so much better than cure.
Now, shifting focus to Delhi, where air pollution was much worse than other cities this year. My colleague Deepa Rana caught up with Dr. Major General Avtar Singh from BL Kapoor Hospital of Delhi about the high number of injured patients because of firecracker accidents.
We had approximately 10 cases of burns, which were mostly due to firecrackers, and mostly they were burns over the face, over the hands, and most of the patients were children. And approximately same number of cases we had last year. There was hardly any difference between this year and last year.
So when the burn cases come, what is the severity of burn cases this year, sir?
These burn cases are usually minor burn cases. They are over face and involving about 5% of body surface area. They are not extensive burns.
And so this year, since air pollution levels have reached to a dangerous mark and the smog is there and winters are approaching, what sort of preventive measures have you suggested to the burn cases patients?
We have to see from my specialty point of view that in fact we had already sent the advisory before Diwali that they should avoid playing with crackers, and even if they have to play, they should keep a bucket of water wherever they are playing with the firecrackers. But still the people, they don't listen, they are not bothered, they do whatever they want.
Now we're talking about New Delhi, which was blanketed with smog for the last 3 days. But of course, Delhi government has woken up to the situation and promised aggressive steps to curb pollution. On Tuesday, Delhi government convened a meeting on this issue. After the meeting, the Deputy CM Manish Sisodia announced a slew of measures that will be taken up. Listen in.
तो पहला स्टेप तो यह है कि जो वैक्यूम क्लीनिंग है, पीडब्ल्यूडी को कहा है कि दोबारा से इसको रिवाइज करके कर लें और शुरू कर दें. तो 2 हफ्ते में फिर से चालू हो जाएगी वैक्यूम क्लीनिंग पीडब्ल्यूडी की सड़कों की. दूसरा, एक नई टेक्नोलॉजी इस्तेमाल करके जो कई देशों में होती है, स्प्रिंकलिंग करते हैं सड़कों पे, थोड़ा पानी छिड़कते हैं जेट लगा के टैंकर से. तो वो जेट का इस्तेमाल करके सड़कों पे स्प्रिंकलिंग की जाएगी वाटर की. पूरी दिल्ली के शमशान घाटों को ग्रीन क्रिमिशन में बदलेगा कि हर एक प्लेटफॉर्म के ऊपर स्मोक टैपर लगाए जाएंगे. एक जो टेक्नोलॉजी यूज़ करने के लिए हम कोशिश कर रहे हैं कि क्योंकि मीथेन इधर उधर से लीकेज होती रहती है डंप में से और वो जलती है वहाँ, तो मीथेन को ओपन छोड़ने की जगह अगर हम उसको ड्रिल कर दें और ड्रिल से पाइप के जरिए मीथेन को बाहर निकाल लें और उसको ओपन एयर बर्निंग करें, तो सिर्फ कंट्रोल्ड बर्निंग होगी वो.
But is it too little too late? Should firecrackers be banned altogether? Is that the long-term solution?
You can watch live TV on our website mpnow.in. Find us on Facebook at facebook.com/magicbricksnow. And don't forget to click the like button. You can also follow us on Twitter at magicbricksnow. To stay updated with all our programming, hit the subscribe button on our YouTube channel by logging on to youtube.com/magicbricksnow.